Hello. I am Dr. Jack Mayhoff, and today I'll be teaching you about the digital rectal exam. Please, come.
Am I in the right classroom?
Absolutely. The digital rectal exam is not one of our finer duties, but it is a necessary one. Some of you may already have familiarity with the exam through your recreational experiences, but for those of you that don't, we'll be walking through it step by step. Please use this time well, as I would disrecommend practicing on each other. There is a barrier with fellow learners that you should not cross. Not everyone will be so predisposed to excel at this exam. One of my colleagues had Marfan syndrome, and with his freakishly long digits, he could navigate any cavity, no matter how large. Now let me see what you're working with. Not bad. Now, me myself, I'm not so gifted, but when I examine a patient, I make sure to explore all corners. I never want a patient to suspect that I might be missing something. Now you see here, your hand is all palm. That's going to be a problem, but that's okay. We'll figure it out. If you prepare properly, this can be a favorable experience for you and your patient. Some of my patients don't mind having a rectal exam 2 or 3 times in the same consultation. Some even appreciate it. Gloves are optional, depending on your preference. Another common mistake that I see by trainees is putting too much lubricant. You don't want to slip and slide when you go down on them. Here, you can pass this around. Get a smell or feel for it. Some standardized patients will have gone through this hundreds or thousands or hundreds of thousands of times. They're well seasoned and will give excellent feedback. For today, we will be doing a simulation. This will be your anus.
Yeah, I don't think this is...
Don't worry, you will get your turn when you have the chance. You, what's your name? Actually, it doesn't matter. Come on. Come up here. Come on, before the day's over.
All right.
I'll show you how to approach the anus. Now, you'll have to tailor your approach depending on the patient. For some that are more nervous, I prefer to strike with speed, swiftness. Angle your finger with the opening, and then draw back to your ear. Once you have a clean angle, shoot. Try it.
I don't know if that...
Try it.
Yeah.
No, here. Elbow up. Draw back. Draw. Now, shoot. Not bad. Not bad. All right, you can go back now. Now, for some patients, you might have to more ease them into the exam. For them, I prefer to circle the rim as I enter. Now, you all may practice. Imagine you're being flushed down a kitchen sink. Slower. Slower. Circle the drain. Circle the drain.
Sir, do you always use one finger?
No. Depends on the patient. Some patients are more like mole tunnels. Others are more like ravines. So you'll have to change your approach. One finger may not be enough. No. Don't end the exam prematurely until you finish. Is that all clear?
Sure.
Excellent. Now, I want you all to take these home to practice. You're never going to get good at this unless you have rigorous, frequent practice. ever want hands-on experience, come in my office. I will now leave you all be, so that those thoughts can ferment in privacy. Don't hesitate to reach out. Was he for real?
Oh, I don't know. What are you doing?
Practicing.